Hey everyone, welcome back to Ask a Dentist. I'm Dr. Phillips. Today we're talking about one of the most sneaky, underestimated types of cavities I see in practice every single day, the interproximal cavity. That's a cavity that forms between your teeth. This one's important because it's largely invisible to the naked eye. You cannot see it in the mirror, you often can't feel it, and by the time it starts to hurt, we're usually looking at something a lot more serious. So let's break it down. Every tooth in your mouth is touching its neighbor at a point called the contact point. That little space between two touching teeth is called the interproximal space, and it's the perfect trap for food and bacteria. When bacteria sit in that space long enough, they produce acid, and that acid eats through the enamel on the side of your tooth. We call that an interproximal cavity, sometimes just called an interprox in clinical shorthand. Now here's what makes this tricky. You're not going to see it. Your toothbrush can't reach it. Even your hygienist can't see it during a visual exam without some help. The only reliable way to catch it early is on an X-ray, specifically what we call bite wing radiographs. That's exactly why we take those wing-shaped X-rays at your checkups. We're not just checking bone levels. We're looking for these hidden lesions between your teeth. So why do these happen? 3 big reasons. Number 1, flossing gaps. Not flossing, or not flossing correctly, is the number 1 driver. Toothbrushes physically cannot get between teeth at the contact point. That's floss's job. If you're not clearing that space daily, bacteria accumulate. And over time, months to years, that acid exposure eats through enamel. Number 2, tight contacts. Some people have naturally tight contacts between their teeth. Tighter contacts make it harder to floss and easier for debris to get packed in. Number 3, diet. Frequent sugar intake, especially sticky foods, gummies, granola bars, sports drinks, gives bacteria fuel. The acid attack happens every time you eat or drink something with sugar or refined carbs. If you're snacking all day, your teeth are getting hit with acid all day. The unfortunate reality, there's no pain signal in early enamel decay. Your tooth has no nerve endings in enamel, so you feel nothing until the cavity reaches the dentin layer or gets close to the nerve. That's when sensitivity and pain start. And at that point, we're usually talking a bigger filling or potentially a crown. So let's talk about what we're actually looking at on an X-ray. On a bite wing X-ray, teeth show up light and white. Enamel is very dense, so it appears very bright. A cavity shows up as a dark triangle or shadow at the contact point between two teeth. We classify interproximal cavities by depth. Class 1, incipient, is just into the outer enamel, very early. We might actually monitor this and encourage remineralization with fluoride rather than drilling immediately. Class 2 hits the enamel, dentin, junction, curer, softer, faster spreading. This needs a restoration. Class 3 is into dentin, definitely a filling, possibly a deeper one. Class 4 is near the pulp. Now we're having a very different conversation, potentially a root canal situation. This is why we don't skip X-rays. Early detection is the difference between a 20-minute filling and a root canal. Treatment depends on the stage. For very early lesions, we may try conservative management first. Prescription strength fluoride toothpaste, improved flossing habits, dietary changes, and we watch it. Some early lesions can actually remineralize if caught early enough. For cavities that have progressed past enamel, we need to restore. The classic treatment is a composite resin filling, tooth-colored material. We access the cavity, remove the decay, clean it out, and bond the composite in. Because the cavity is on the side of the tooth, we're coming in from the top at an angle to reach that contact area. It's a routine procedure. For larger cavities that undermine a lot of tooth structure, we might be looking at an onlay, a crown, or if it's reached the nerve, a root canal before the crown. Recovery is minimal, local anesthetic, short appointment, usually 30 to 45 minutes. You might have some sensitivity for a few days. Nothing major. Cost without insurance. A one-surface composite in most markets runs $150 to $300 per tooth. A crown, if it gets that far, is $200 to $2,000 or more. That's the cost of waiting. Here's the good news. This is almost entirely preventable. Floss every day. I know I'm a dentist, I have to say it, but I mean it. Regular string floss, floss picks, a water pick, interdental brushes. Anything that gets between those teeth daily removes the bacteria before they can do damage. The water pick is excellent, and I recommend it, but I still suggest pairing it with floss because the mechanical cleaning of string floss is hard to beat. Use a fluoride toothpaste. If you're high risk, a prior history of cavities, dry mouth, high sugar diet, ask your dentist about prescription fluoride or fluoride varnish at your cleanings. Watch your snacking frequency. Less frequent sugar exposure means less acid attack time, means less decay risk. And it's not just about how much sugar, it's how often. Keep your recall appointments. Every 6 months is standard, or every 3 to 4 months if you're high decay risk. And when we recommend x-rays, get the x-rays. They're low dose, and they're how we catch this early. Bottom line, interproximal cavities are common, sneaky, and completely avoidable with consistent habits and regular care. Don't wait for pain to be your diagnostic tool. Pain means it's already progressed if you've been overdue on a cleaning or haven't had x-rays in a while. That's your sign. Book it. Drop your questions in the comments. I read everything. If you found this helpful, share it with someone who hates flossing, and I'll see you in the next one.